Welcome to Dr. Mateo. Health, prevention, wellness.
Hello, I'm Dr. Mateo. Today, I want you to take a very deep breath and look at something we often take for granted, your medicine cabinet. For years, the conversation around dangerous drugs has focused on illegal substances or rare experimental treatments. But I'm here to tell you a truth that might be hard to hear. The most dangerous drugs for your heart, your brain, and your long-term health are often the ones you trust the most. I'm talking about the little pink pill you take for allergies, the stomach capsule you've swallowed every morning for years, or the safe pain reliever you grab the moment your back aches. We've been told these are routine and necessary, but groundbreaking research is raising serious red flags. Whether you are in your 30s or your 70s, your body relies on delicate chemical balances to keep your nerves firing and your heart pumping. When we disrupt those balances with everyday medications, we aren't just treating a symptom, we might be triggering a biological war zone inside our own cells. In this video, I'm going to reveal the hidden killers that might be sitting in your home right now. We're going to look at why these drugs are shrinking memory centers in the brain, causing sugar rust in your nerves and turning your arteries into bone. Most importantly, I'm going to give you a clear map, a way to talk to your healthcare provider and reclaim your health without being a zombie to your prescriptions. 1. The heart's Russian roulette, NSAIDs. Let's start with a medication found in almost every home, NSAIDs. You know them as ibuprofen or naproxen. We use them for everything: headaches, sports injuries, or joint discomfort. They work brilliantly for pain, but for your cardiovascular system, regular use can be like playing Russian roulette. The medical community has known about this for decades. In 2005, the FDA demanded clear warnings about heart attack and stroke risks on these boxes. Here's the mechanical reality. NSAIDs block certain enzymes to reduce inflammation, but they also interfere with substances that protect your kidneys and blood vessels. This forces your body to retain salt and water. Imagine your heart as a pump. If there is suddenly much more fluid in the pipes, that pump has to work at maximum capacity just to keep up. For many people, this leads to a silent spike in blood pressure. Even worse, if you take low-dose aspirin to protect your heart, ibuprofen can actually neutralize that protection, leaving you completely vulnerable. The answer isn't to live in pain, but to be smart. Always ask for the lowest dose for the shortest time. Consider natural anti-inflammatories like curcumin or ginger, which research suggests can reduce inflammation without the same cardiovascular tax. 2. The stomach pill that starves the brain, PPIs. Next is a medication marketed as a stomach protector. I'm talking about proton pump inhibitors like omeprazole or Nexium. Millions take these for years for reflux or heartburn. But here's the bitter irony. The pill meant to protect your stomach might be starving your brain. Your stomach acid is the key that unlocks nutrients like vitamin B12 and magnesium. When you suppress that acid long-term, your magnesium levels can plummet. Magnesium is the guardian of your heart's rhythm. Without it, your heart becomes electrically unstable, like an orchestra without a conductor. Furthermore, research has found a terrifying link between chronic PPI use and an increased risk of dementia. By messing with your stomach acid, these drugs may be increasing toxic plaques in the brain. If you've been on these for more than 8 weeks, you might be triggering a chemical fog that steals your mental clarity. The solution? Talk to your doctor about a step-down plan. Sometimes simple lifestyle changes or milder alternatives like H2 blockers can manage the symptoms without the long-term brain risk. 3. The memory thief, anticholinergics. I need you to listen closely here because this involves a drug you can buy at any grocery store, diphenhydramine, commonly known as Benadryl. Many people use this as a sleep aid or for allergies, but inside your brain, this drug is actively disrupting the hippocampus, your memory center. Benadryl belongs to a family called anticholinergics. They work by blocking a chemical called acetylcholine, which is the messenger your brain uses to create new memories and stay alert. A 2023 study found that regular use of these drugs is linked to a significantly higher risk of developing dementia. This isn't just about Benadryl. This same brain-blocking effect is found in some bladder control medications and older antidepressants. The solution: if you need an antihistamine, look for newer versions like Claritin that don't cross into the brain as easily. For sleep, look into magnesium glycinate, which naturally calms your nervous system without stealing your memories. 4. The thief of peace: benzodiazepines. We all face anxiety or trouble sleeping at different points in our lives, and often the first thing prescribed are benzos, drugs like Xanax, Valium, or Ativan. At first, they feel like lifesavers because they quiet racing thoughts. However, long-term use can create a chemical sedation that slows down everything in your brain. A major study found that using benzodiazepines for more than 3 months increased the risk of Alzheimer's by over 50%. Your brain essentially stops learning how to be calm on its own. The solution: never stop these medications suddenly, as the withdrawal can be dangerous. Work with your healthcare provider to slowly taper the dose while exploring cognitive behavioral therapy or natural relaxation techniques. 5. The nerve starvation trap: metformin. For those managing blood sugar, metformin is often the gold standard. It's a life-saving drug for many, but it has a hidden side effect. It actively blocks the absorption of vitamin B12. Between 10 and 30% of people on metformin develop a deficiency. Why does this matter? Because vitamin B12 is the master electrician of your nervous system. It builds the myelin sheath, the rubber insulation on your internal wiring. Without B12, your nerves start to spark and fray, causing the burning and tingling known as peripheral neuropathy. The solution: if you take metformin, you must demand a functional B12 test, checking MMA and homocysteine levels. Supplementing with the active form, methylcobalamin, can help protect your nerves from being starved by your medication. 6. The brain's energy crisis: statins. Statins are some of the most prescribed drugs in the world for lowering cholesterol. But here's a fact many don't realize: your brain is composed of nearly 60% fat. Cholesterol is a vital building block for the protective coating of your brain cells. Research has shown that in some cases, high-dose statins can lead to cognitive impairment because they essentially starve the brain of the very fats it needs to stay sharp. The solution: if you are noticing brain fog or memory lapses after starting a statin, discuss a dose adjustment or alternative with your doctor. Protecting your heart shouldn't come at the cost of your mind. 7. The vitamin toxicity: vitamin B6 and A. It isn't just prescriptions. Even vitamins can be dangerous if misused. Vitamin B6: many people take nerve support formulas with high doses of B6, but the synthetic form, peroxidine HCl, can actually be neurotoxic in high doses, killing the very nerve endings you're trying to save. Vitamin A, or retinol: in supplement form, it can accumulate in your liver and fatty tissues. Excess vitamin A has been linked to a higher risk of irregular heartbeats, or atrial fibrillation, and stroke. The solution: stick to food sources for vitamin A, like carrots and sweet potatoes, and ensure your B6 intake stays in a safe range, under 25 to 50 milligrams. 8. The artery stiffener: calcium alone. For years, we were told to take calcium for strong bones, but taking a plain calcium pill without vitamin D3 and K2 is a major risk. Without those directors, the calcium doesn't go to your bones. It wanders into your arteries. It hardens into calcified plaque, making your arteries rigid like bone. This spikes your blood pressure and forces your heart to pump against a stone wall. The solution: focus on getting calcium from food first, like sardines, leafy greens, almonds. If you must supplement, never take calcium alone. Always pair it with vitamin D3 and K2 to ensure it stays out of your heart and in your bones. The Dr. Mateo strategy: reclaiming your health. I don't want you to be afraid of medicine, but I want you to be the CEO of your own body. You deserve to understand exactly what is going into your system. Here is your action plan starting today. The medication audit. Take a complete list of everything you take, prescriptions, vitamins, and supplements, to your next appointment. Ask, is this still the best option for me? Are there safer, more natural alternatives? The nutrient timing reset. If you take metformin or a PPI, start a high-quality sublingual B12, methylcobalamin, to bypass the absorption issues. The magnesium shield. If you're dealing with cramps or sleep issues, try magnesium glycinate before bed to calm your system naturally. The H2R protocol. Stay hydrated. Dehydration makes your blood thick and your medication more toxic. Drink room temperature water with trace minerals first thing in the morning to flush your system and support your cells.